Hello and welcome into Talk of the Town. Lots of ground to cover on the show today and lots to talk about when it comes to physical therapy. And that's where we're going to start on this episode as we bring in Kevin Waite from the Sport and Spine Clinics. How you doing there, Kevin?
Doing well. Thanks for having me.
Yeah, thanks for joining us. Let's talk about, the healthcare industry in general seems to be changing a lot. How does physical therapy kind of fit into that model of treating patients?
Yeah, absolutely. No, as the weather gets warmer and people are getting more active, we're going to have 60 degrees next weekend. People go out and have a run. We're really that first line of defense if somebody has an injury to their knee or ankle or anything musculoskeletal, something painful in the muscle or joint. We are the go-to providers for getting that better as quickly, effectively, and actually less costly as possible.
So a lot of weekend warrior stuff.
A lot of weekend warriors. Yeah, we see a lot of those.
What's the most common condition that you see from those weekend warriors, and then how do you also help prevent that?
A lot of the most common condition we probably see is actually back pain. So not as much of the weekend warrior stuff is sometimes back pain. That's more knee and shoulder pain, sprain an ankle, that type of thing. But back pain is actually a giant problem in the healthcare industry. That's something that I see probably 50% of my patient load is back pain. And the way to prevent that is, it's a hard question to answer in a short period of time, but really trying to stay in better physical condition, have better body mechanics with lifting things, and actually just staying active. A lot of people that have chronic back pain, they get afraid of having more back pain, so they actually avoid different activities that will make their pain better.
So now when it comes to back pain, because the first thing that jumps in my head is back pain, go see a chiropractor.
Absolutely.
Now, should they see you instead of a chiropractor or see you in conjunction with their chiropractor?
Well, chiropractors and us, we have a different approach to how to get back pain better on some things. Some things we do similarly. We do mobilizations to the spine as well. We just have a different take on it, but our focus is more on getting muscles to activate, getting people to move better so that they're not avoiding activity, they're really enhancing their activity.
And speaking of those activities, as it gets warmer, we're going to see a lot more runners out there as well.
Yep, I'm excited.
Sure, yeah, right. It's got to be a busy time for you then.
Absolutely.
Because the runners get hurt. What are the more common things we see from runners getting hurt, and how do you prevent that as well?
The big thing people think about with running is shin splints and just overuse type of injuries. So the biggest thing that I see is people tend to get out and run too much too quickly as opposed to ramping things up. So it's a nice 55-degree day and people want to go out and run 5 miles when they haven't done it all winter. And so some people really know how to be a good runner, and they've done it for years, and other people try to get back into it because they want to lose weight, and they don't necessarily approach the get back into it the right way.
Now say, I've overdone it, I've hurt myself, but I think, I've seen a physical therapist in the past. I'd like to see a physical therapist again. Can I go right to seeing a physical therapist, or do I got to go through my primary doctor?
A lot of it depends on your insurance, actually. Unity is one of them that we can see you right off the street, and we still engage with the primary care physician because they're a critical part of the team, and we want to make sure that they are involved in that process. But a lot of people can come to us directly, and again, we are much cheaper, much less costly than a physician or downstream costs like getting an MRI or getting an X-ray or pain medication. That's another big problem these days is people get addicted to narcotic pain medications. And so our big mission is to get people off of that stuff so that they can get back to their lives faster.
Now you mentioned X-rays and MRIs. What if I think I need one? How would I know if I need one?
Well, you'd come in and see either your physician or come in and see us. X-rays and MRIs are probably one of the most overutilized and expensive things, more on the MRI side. MRIs are very expensive, $3,000 depending on where you are dollars. And a lot of times they're not really necessary to either change the plan of care, meaning change what we're going to do to get you better, or they're not really necessary to screen things out that we want to see. So especially in back pain, that's a big issue these days, is that MRIs find things classically that aren't necessarily important in the first place to begin with.
Now, say I want to have a home gym. I don't like going to the gym or something like that, or I want to set something up. What kind of equipment would you recommend?
I would recommend a bike or something that people enjoy doing. So, easy equipment to have at home. You can have different weight equipment, resistance training types of things like dumbbells, a bench. You can do a lot of like step up things for your legs and for your upper body with those types of pieces of equipment. But the main thing is trying things out, maybe going to a gym once or twice and seeing what equipment they have and what would be possible to have in your home. But the big thing is actually enjoying it, because most people, it turns out to be a laundry hanger rather than an exercise equipment.
Absolutely. Kevin, thanks for joining us today.
Absolutely, thanks for having me.
And we got more Talk of the Town coming up next here on CW57.